You are watching McLaren Report here on today's health program, and I'm speaking with Dr. Timothy Lukas about surgical options for patients that have hip pain. So Dr. Lukas, thanks so much for staying with us. To start this segment, I wanted to ask about what are the non-surgical options for people that have hip pain?
So for people that have hip arthritis, and I can show you an example of that on this x-ray. So again, the hip is a ball and socket joint. The space between there normally represents your cartilage. You can see in this patient they don't have any cartilage. But we don't treat the x-rays, we treat the patient. So to start with, we start non-operative options, anti-inflammatory medications to help with the symptoms and the inflammation, analgesics like Tylenol and whatnot. There's a big push not to treat this type of chronic pain with narcotics, and I'm on board with that. So we really try to limit the use of those. Then there are other options, stretching programs, physical therapy. If a patient's really having a hard time getting around, we'll consider unloading that joint with using a cane in their other hand for a while. A lot of people are resistant to using canes, particularly my older patients. They don't like that. They don't like to be reliant on something like that. Injections don't tend to be very helpful for hip arthritis, so I tend not to do a lot of that. And then if that all fails and the quality of their life is terrible because of the pain, then we start thinking about surgical options.
And for a lot of people, that's a big decision. But when, like you said, when it really impacts their quality of life, it's a time to discuss that. So let's talk a little bit about what those surgical options are.
So surgical options for end-stage arthritis of the hip, again, this is an example of that. There's just no cartilage left. So if this patient came in and they'd failed conservative measures and we looked at this x-ray, there's really only one surgery that's going to make a big difference for this patient. That's hip replacement. Taking the worn out areas out on both the ball and the socket side, and that's what gives pain relief. And the difference between before surgery and after surgery for patients that do surgery for the right reason tends to be pretty stark. They tend to be really happy they've had it done. So here's an example of the after picture. So the white portion's the metal, so the new socket, the new ball, and that's anchored inside the patient's bone, and the patient's bone actually grows into that implant over time.
So give us a little bit of overview of what happens during a hip replacement surgery.
So different ways to do hip replacement, that has really evolved over the past several years. For most patients these days, I'm doing a muscle sparing approach, an anterior approach to the hip, where we don't have to take off a portion of the muscle. We just spread the muscle, do the replacement, take the worn areas out, and afterwards they're able to get up and mobilize faster than they used to before with less pain. So patients are actually leaving the hospital usually the next day in most cases, and there's a big push at some point to consider outpatient total hip replacement.
Which is just astounding to me because I've been a nurse for a very long time, and when I first went into practice, patients would still be in the hospital and we'd take out their staples. So
yes.
That tells you how much things have changed.
They used to stay in for a week to 2 weeks, and that really has changed. And people are doing better now than they used to after replacement because of the approach we use to the surgery.
So the anterior approach is the incision then is on the front. Are there other techniques that you use too?
Certainly, there are reasons for doing other approaches. There's also the direct lateral approach where you take a portion of the muscle off, and there's a posterior approach where you do take some of the muscle off as well. And there are different reasons for doing those different approaches, but I'd say the vast majority of people that come in with arthritis tend to get the anterior approach these days.
And you had talked about how usually patients are only in the hospital one day, but there's other advantages to that approach as well, right? Less like blood loss or things like that?
Mostly they get their strength back faster because you're not detaching the muscle, so they're able to get up and ambulate faster. They have less pain because you've done less dissection.
Yeah. So what would a patient expect after a hip replacement surgery?
So usually in the hospital overnight, go home the next day. I usually have people using a walker for 1 to 2 weeks, but you're able to put full weight on that leg right away. After that, a cane for a week or two, and then after that, off of both. So after a month, you're doing pretty well, getting around functioning pretty normally, but 2 to 3 months to kind of get back to full speed is a reasonable estimation.
So most patients probably go home. Are there some patients that maybe might need a little bit more help after surgery?
Certainly there's a percentage of people that are going to need some extra help, and they'll be candidates for rehab afterwards. I'd say that's about 5 to 10% of the population. But that's something we consider, and while they're in the hospital, they're working with therapy. We're getting a good gauge of whether they're able to function on their own and get back to their living situation.
And those patients that go home maybe might have a visiting nurse or someone coming in to check on them?
Yeah, we arrange visiting nurse and visiting therapy for all of our patients that have hip replacements.
I think now is hip replacement surgery still considered the #1 surgery in the world? Do you know?
That's a good question. I don't know.
Yeah.
But I can tell you it's one of the most successful.
Yeah.
One of the most successful.
And I know that because hip replacement surgery has been around for a very long time, and probably everybody knows someone that maybe has had a hip replacement, but the devices themselves last a lot longer now. Is that
Yeah,
right?
so the materials that we're putting in, both on the implant side and what we call the new cartilage or the plastic side, that's probably where the most advances have been made. The plastic is more durable, it doesn't wear. It's the wear of that plastic that causes, problems down the line, or used to cause problems down the line. Now it's much more durable than it used to be. And we're using other materials too, like ceramics on the plastic, to try to last even longer.
Yeah, so what do you tell patients? What's the average life expectancy then of the hip replacement?
That's a tough one to say, just because there's a lot of variables that go into that. I would tell people to expect, on average 20 years for a hip replacement. That's not to say that some people don't get more and some people get less, but 20 years I think is a reasonable estimation.
So can you give us an overview of what happens during a hip replacement surgery?
Sure, I'll use this model to kind of give us an idea, or give you an idea. So if we look at the hip, again, we have a ball and a socket joint. That's the socket, that's the ball. So on the socket side, we actually use a device kind of like a hemispherical cheese grater to take out the remaining worn out cartilage and a little bit of the bone. And then we make a perfect fit for this socket that we press fit in there. And again, your body, the bone will grow into that device over time. And then we'll put a liner, most of the time it's a plastic liner, inside that socket that fits snugly. And then on the other side of the hip, the ball portion, we actually take off the ball, and then once we have that ball taken off, we make a secure fitting inside the bone for the stem that anchors in there. And then again, over time, the bone is going to grow into that stem, and so then the new ball is anchored on that stem. And so what holds that in place is basically the muscles around the hip. So that's one of the reasons that not detaching the muscle tends to help people recover faster.
And I think this picture here of the x-ray kind of shows what it would look like in...
Yep, that's an actual hip that I implanted.
Now for most people, like we think of older adults that would need a hip replacement surgery, but that's not always the case. Right?
No, people, for whatever reason, whether it's repeated trauma or one major trauma, and things degenerate over time, they're getting hip replacements done at a younger age because they realize that it's a good procedure, gets rid of the pain, it's durable, it lasts longer than it used to, so they're doing it at a younger age and not waiting until they're retired.
Right. This has been really great information, but we do need to take a break, but we will continue this discussion when we return.